President, I come to the floor today, as I have for the last 2 years since the health care law was signed by the President, to give a doctor's second opinion about the health care law. And I do this week after week because we need to recall that it was Nancy Pelosi, then Speaker of the House, who famously said that Congress had to first pass President Obama's health care bill to find out what was in it. It's now been 2 years. We continue to find out more and more what is in the law as people read it. And even this morning, the Wall Street Journal had a story about the upcoming 2-year anniversary and, of course, the Supreme Court hearings, which will begin in a little over a week, about whether or not this health care law is constitutional. I believe it is not, but the 3 days are being devoted to that discussion. And that Wall Street Journal article today shows a poll of from the time that this health care law was passed all the way through today, and as of today, the health care law is still more unpopular than it is popular. More people are opposed to the health care law even 2 years after it was passed than are supportive of it. Interestingly, other studies of the American populace show that as more people know more about the health care law, they actually are less likely to support it. And people who've talked to a health care provider, a nurse or a doctor or a therapist, is even less likely to be supportive of the health care law. And the reason is because as more people learn about the health care law, the more they learn about it, the more they don't like it. And so much of this specifically relates to the mandate that everyone in the country is going to be obligated to buy a government-approved product, and that's the crux of the discussion and the debate that will be held within the Supreme Court in the weeks ahead, and then a decision to come within the next couple of months. And it's interesting as one goes through the process of how this law was passed. It was party line vote, middle of the night votes, closed-door sessions, in spite of the President saying all deliberations and discussions would be on C-SPAN, that the American people were saying, no, do not pass this, but in spite of the objections of people all across the country, this bill was crammed through the House and the Senate and signed by the President at a time when people said, this isn't going to give us what we want. And what we want is care that we need from a doctor that we want at a price that we can afford. The President made lots of speeches and lots of promises to try to let the public know that he was listening to them, but he wasn't listening to the public, wasn't listening to this side of the aisle. And that's why this health care law actually, it fails patients. It fails providers, the nurses and the doctors who take care of those patients, and it fails the American taxpayers. I remember the President saying, if you like your plan, you can keep it. And he said, even when he was running for president, he said, you will not have to change plans. He said, for those who have insurance now, nothing will change under the Obama plan except that you will pay less. That's what he said. But yet I went to a town hall meeting in Wyoming, as I go home to Wyoming every weekend and visit with people, and you ask this group of, I don't know, 100 citizens, how many of you under the President's health care plan believe you're actually going to pay more? Every hand goes up, every one. Yet the President said that you'd save $2,500 per family. The American people haven't seen that. So they listen to the President's promises and they say, I'm not sure if I can believe what he has to say. The President talked about protecting Medicare. He did that in an address to Congress in 2009, and yet with the health care law, they took $500 billion away from Medicare, not to save Medicare, not to strengthen Medicare, but to start a whole new government program for other people. So when I talk to seniors, they have great concerns about the way that Medicare has been handled in this health care law. Specifically, their concern is they're not going to be able to find a doctor to take care of them. And when I talk to doctors at home in Wyoming, and I practiced medicine for 25 years, what I hear and what I see is that for patients, and these doctors, their offices are all full. I mean, in terms of the health care law, I think it failed in helping us have more doctors and nurses and nurse practitioners and physician assistants But when I talk to them, they say, you know what, patients that I've taken care of for years and who are on Medicare, continue to take care of them. Patients who are turning Medicare age, continue to take care of them. But in terms of someone who may move to a town or someone whose doctor may retire, it is getting harder and harder for patients on Medicare to find doctors to take care of them. And a lot of it has to do with the concerns about reimbursement, the so-called doc fix that is part of the debate that recently was extended with payroll tax holiday legislation. But there's very little certainty that comes out of Congress, and doctors look at that and say, how can I make decisions about my practice and my life when I don't know if they're going to cut Medicare fees by 27 or 30% at the end of the year? They faced a similar situation at the end of last year. They faced a similar situation just at the end of February. So it's not a surprise that doctors are more and more reluctant to accept new Medicare patients when their offices are already full with patients. So we look at all of this and say, is it a surprise that this health care law is as unpopular as it is? The president said this will not add one dime to our deficits. Add not a dime to our deficits. We have another budget this year, another deficit looking at $1 trillion. The CBO report came out yesterday talking about greater money being spent that had been anticipated, higher deficit. But the president's promise, he said, I will not sign a health care plan that adds one dime to our deficits, either now, he said, or any time in the future, period. But if you take a look at an honest accounting of the health care law, it is going to find that this will increase the deficit by hundreds of billions of dollars in the first 10 years alone, and much higher than that beyond that. You know, I remember listening to the debates, and here we are in another presidential year, the debates in 2008, when President Obama, who was then a senator, member of this body, and Hillary Clinton, also a senator, member of this body, were debating what they saw as the future for health care. At the time, candidate Obama opposed a mandate to buy insurance, a mandate that is now part of, and actually many call the linchpin of this health care law, the thing that's going to be discussed and debated in the Supreme Court, the thing that the court is going to rule on whether it's constitutional or not. It is at the heart of President Obama's health care law. He, of course, opposed it when he was a candidate, and he actually made it one of the hallmarks of his primary campaign against then Senator Clinton, his opposition to the mandate. So people scratch their head and say, what is he really for? What does he stand for? The president, when he was senator, claimed that penalizing people for not buying health insurance was like, and I will quote him, it was like, he said, solving homelessness by mandating everyone buy a house. That was his words, talking about the impact of a mandate. So here we are now, 2 years later. 3/4 of Americans believe it's unconstitutional for this body, for Congress, and for any president to sign something that mandates that they buy a government-approved product. Don't know what the Supreme Court's going to do, but in fact, the American people are opposed, significantly opposed, to the key component of the president's health care law. The president also said we won't raise any of your taxes, and yet there's a list of taxes that have been raised as a result of this health care law. So it's not surprising that 2 years later, there are more people opposed to the health care law than support it. You know, you kind of think about the president and the statements that he's made and the statements made on the other side of the aisle in the run-up of the health care law, and it's not a surprise that then 2 years later, people saying, that's not what happened. I remember the discussions and debates on this floor about the small businesses and the expenses that this was going to place on our small businesses. And the president said 4 million small businesses may be eligible for tax credits. The key word, of course, there was may. In fact, the IRS spent $1 million in taxpayer money to mail millions and millions of postcards to small businesses promoting the so-called tax credit. But Treasury Department's Inspector General, here we are 2 years later, recently testified that the volume of credit claims has been lower than expected. Lower than the Democrats promised, lower than the president talked about, but not lower than people that actually read the bill, read the law, thought would occur because of the requirements, what would need to do to apply, what the incentives were, what the consequences were. And they found out of these 4 million promised small businesses to get help, the Treasury Department's Inspector General says only 309,000 firms have received the credit. 7% of the 4 million firms that the administration and the Democrats in the Senate said would receive the tax credits. So when people look at that and say, did they really help me? The answer is no. And that's why when I ask the second question at a town hall meeting, not the first, of course, which is, do you think you'll end up paying more under the Obama health care law, the one that promised that you'd pay $2,500 less? All the hands go up. They believe they were going to pay more. And then the second question is, do you believe that the availability and quality of your care under the Obama health care law is going to go down? Go down. Nobody wants that for themselves or their parents or their kids. How many of you believe that it's going to go down? Everyone raises their hand. They all believe that they will receive less available, less quality, less timely care than they were able to achieve before the health care law was passed. And that's why I come to the floor each and every week with a doctor's second opinion about the health care law, because each and every week there is something new that has been found or a new regulation that comes out, because let's not forget, in this lengthy health care law, lengthy, heavy health care law, 1,700 times it says that the Secretary of Health and Human Services will write rules and regulations really describing what the law says. So when you take a very small part of the law, 4 or 6 pages relating to accountable care organizations, and come out with 400 pages of regulations about accountable care organizations, even those places that the president holds up as models of where it works well, places like the Mayo Clinic or the Utah healthcare system or Geisinger in Pennsylvania, many of those who say we cannot comply with all of these rules and regulations that are now coming out from the Secretary of Health and Human Services. And every week a new series of rules and regulations comes out, a new series of mandates, and doctors and nurses are finding that they're spending less time with patients and more time with paper, and it is hurting the job creators of the country. They don't know what it's going to cost them, but they know it's going to cost more. The incentives and the consequences within the law are not those that are going to encourage businesses to continue to provide health insurance. I believe it's going to result in more and more people being dumped by their employers onto a different system with a significant expense to taxpayers around the country. And that's why, Mr. President, I come to the floor week after week to talk about this health care law and say that it's bad for patients, it's bad for the providers, the nurses and doctors who take care of those patients, and it's going to be terrible for taxpayers. And that's why I believe that we need to repeal and replace this terrible broken health care law with something that is actually patient-centered, which puts the patient at the center of the discussion. It's not government-centered, not insurance company-centered, but patient-centered. And with that, Mr. President, I yield the floor and note the absence of a quorum.